my name is Elaine Carrere. I'm an occupational therapist at Spirit Physical Therapy. I treat at the Brooklyn Heights location and the West 57th Street location. I treat patients with upper extremity injuries starting from the shoulder, elbow, hand, and wrist, and I also treat the pediatric population. So have you ever wondered what occupational therapy actually is? Let's look at the definition of occupation. Occupational therapy isn't about finding someone a job. Occupations are actually everyday activities that people do that are purposeful and meaningful to them. So the difference between PT and OT is that OT is focusing on function and helping people live as independently as possible while recovering from an injury, an illness, or disability. The approach is more holistic. We're promoting meaningful, purposeful activities. So if someone comes in, maybe their occupation is they're a chef, they have a wrist fracture, they need to be able to learn how to use a knife again. So an OT can help work with them on how to maybe adapt the knife so they'll be able to use it at work. Whereas PT has a little bit more of a biomechanical approach where their primary focus is range of motion, strength, and endurance. So some people may think that OT is only treating the upper body and PTs are only treating the lower body. So sometimes in a hospital settings, a patient may have a hip replacement and may have to maintain some hip precautions. An OT can actually work on the lower body hip precautions and educating the patient on how to get dressed while maintaining those hip precautions. An OT can also help that patient be able to learn how to get in and out of a tub and on and off a toilet as well. So anyone with a mental, physical, or developmental impairment can benefit from OT. So in our pediatric population, we can work on developmental milestones. We can help kids learn how to hold a pencil or cut or write and also socialize with their peers. With our older adults, we can help adapt their environment or give them adaptive equipment so that they're independent as possible. And in our orthopedic population, we can help them return back to their occupations prior to their injury. So to recap, occupational therapy focuses on function and getting you back to the things that you were doing prior to your injury. For more information about occupational therapy, visit us online at spearcenter.com/occupational therapy.